Dr. Kaylee Garrett-Simmerman here, physical therapist. As promised, today we are talking about pelvic floor dysfunction in the performer. When I describe a performer, I am speaking of dancers, musicians, and stage artists. So people that are acting, actresses, actors, anything like that. Those are the types that I have the most experience with. There are several other types of performers, and if you do need someone to talk to about what type of performance pelvic floor dysfunction that you might have, please let me know. I may be able to direct you into that right direction. Now, when it comes to performance arts, I also want to define the pelvic floor dysfunction side of things. So we have the performer. I've told you who I've worked with and who I have experience with. So now let's talk about what I mean when I say pelvic floor dysfunction. What I mean by that is anything from leaking of urine and leaking of feces all the way down to the muscular scope of things, meaning you have a weak pelvic floor, your pelvic floor is too strong or has too much tension or tone, meaning tightness of that muscle. You may have a separation of your core muscles. You may have pain with intercourse. You may have pain in the pelvic region. You could have some SI joint or sacroiliac joint pain. You may have some dysfunction with mobility. You may have some trigger points. Most likely, I treat with my performers a lack of coordination, a lack of control, and some sort of leakage. And what I mean by that is there's two types of leakage that I deal with. Well, technically three if you put them together. But one is stress incontinence, and then you have urge incontinence, and then you have mixed incontinence. When you have stress incontinence, that's when you have any increased pressure that causes you to leak on yourself. So with my performers, for instance, a warm-up for a vocalist may cause stress incontinence because you're working your diaphragm a lot. You're getting more pressure in the abdominal wall, and that's pushing a lot of that urine out. And then when you have urge incontinence, if you get to the stage and you're on the side of the stage and you're about to go on for your pas de deux and you're getting ready to go dance, all of a sudden you have to pee and you cannot hold it. That's more of the urge incontinence. So again, stress incontinence is when you laugh, cough, sneeze, jump, whatever it might be. A lot of my patients have noticed it with their jumping or their turning when it comes to dance-related pelvic floor dysfunction. And then you have the urge incontinence, which I've noticed is more so when we are getting ready for something or when we get the urge and we find those triggers when it comes to that performance. For me, for instance, I have the incontinence or the urge incontinence where I cannot hold that urine in. When I get home and I put my key into the door, that starts a trigger, and then I have to either revert the situation or try to forget about what's going on in that urge incontinence, or I will leak myself. And I also have the stress incontinence, which I shared in my video on Monday. So keep that in mind. Those are the two most common things that I see with my performers as far as what type of dysfunction. With my ballet dancers or with the dancers, I hear more so about the pelvic pain side of things. Pain with intercourse, pain with different types of activities such as splits or pain with certain movements. And a lot of times that is just because we don't have the appropriate coordination of our diaphragm, our core, and our pelvic floor. So the patient is not able to actually coordinate everything together. A lot of times in performance arts, we focus on the whole body and we focus on being able to do everything for the whole body that is appropriate. However, if we don't backtrack and take it one step at a time and learn the proper way to breathe and learn the proper way to contract the core, learn the proper way to do pelvic floor techniques, you can't go straight into Kegels. I wrote a blog post about that previously. You cannot just start Kegels. You have got to start with just finding where you are, what's going on with your body. I urge my performers to do that. And I urge my performers to also start with a pelvic floor PT. If you need help finding one, please let me know. Now, when it comes to that, those are the most common types of performance dysfunctions, pelvic floor dysfunctions that I see with my performers. Now, if you go on to what causes that, that's a whole different story. So stress incontinence is really just a lack of coordination. The signaling is somehow messed up in the body. So it's giving a signal to pee when you get increased pressure, and it should not be giving that signal. We can coordinate better with that. We can change things, we can change things to make that improve. And then with urge incontinence, you can do different behavioral mechanisms to improve that. So like I was saying when I put the key in the door, if I try to get my attention somewhere else, so in other words, if I distract myself from the sensation to pee, then a lot of times I forget that I have to pee if I know that it's not time to pee. You want to obviously go to the bathroom when you have a full bladder, but you have to learn the difference between having a full bladder versus thinking you have a full bladder because you've heard a trigger like running water. I know for me also, when I get anxious or when I get nervous, I have to urinate often or more often. And that's something that you can work on to improve. That's something that you can take different steps to improve. You can do things such as a bladder schedule. You can put yourself on that schedule. Drinking more water, believe it or not, improves incontinence. It does not make you urinate more, or does not make the incontinence worse. It can, of course, make you urinate more often. However, it will not make the incontinence worse. It actually has been shown that that's going to improve it if you drink more water. So drinking more water, changing the way you're sitting on the toilet. I've talked a little bit about that before. Making sure that you're leaning forward with your elbows on your knees, lifting the knees a little bit above the hips. If you don't have a squatty potty, that's a great option. Doing different things like that is what's going to help to change that situation for you. It's going to help to change the pattern of sensation that you get when you have to void or when you have to pee. In other words, once you take these different behavioral changes, it's going to improve the signaling from the brain to the spinal cord to the bladder, and it's going to tell you when you actually truly have to pee. So those are really the biggest things that I can recommend right now. If you have any specific questions or any specific problems that you're going through and you would just like a little advice on, please let me know. Reach out to me through here. You can check out my blog and comment there. I have several blog posts that are talking about these types of issues. But again, today was all about performers and pelvic floor dysfunctions, and Jenna Cantor had asked that question that I would address it. So hopefully this answers any questions that you have about that topic. All right, have a great day.